All right, folks, so we'll go ahead and get started. Hello, everyone from LA Care Health Plan. I am Dr. Katrina Miller, and we are very happy to have you joining us today for our webinar on encounters for clinical quality. And we'll be talking to you about all kinds of things about encounters and how you can best get your encounters to us, LA Care, for all of the purposes that we need to use it for. So just to let you all know, this webinar is being recorded for future reference. So if you have any issues with that, just let us know. But also, you'll be speaking to us largely through the chat function, and we'll talk about that in just a moment. Make sure that when you sign into these webinars, you put in your full name, but also if you can note your IPA so you know, so we know where you are coming from, that's really great. And that generally happens through the registration, but you can also add that in with your name when you are signing into the WebEx as well. So just keep in mind, it's great for us to know your full name and your IPA if possible. Also, just to let you know, we will be sending out a copy of this PowerPoint after the presentation. So if you didn't pick up some of the detail while we're going through it, don't worry, we will be sending it out to you. And at the end of the presentation, we will hopefully have time for questions. So the questions will be managed through the chat function, and it's either Q&A or chat, and it'll be on the right-hand side of your webinar. And so if you have questions as we're going through the webinar, feel free to enter them. And when we get to the end, we will take a look at the questions and try to collate the ones that are similar and answer them together and try to get to as many as we can at the end. Also, please let us know through chat if you cannot hear or see the slides, and we have Carolina monitoring the chat to make sure that you have any problems, she will be able to take care of that for you. Now, why are we here? Well, you all have probably joined us for some of our presentations on the Value Initiative for IPA Performance, or VIP, and also for our Pay for Performance programs. So that's another thing that we're looking at today. Now, encounter data is used for many things, but in particular, we know that it's very important for us to be able to get encounters into LA Care Health Plan so we can actually create the HEDIS clinical quality rates and scores. We also need it for our utilization metrics, and so the more we can get those encounters in, the better off we are. And the more we can get them in a timely manner, the better off we are. So you can see that in our VIP program, we have set up for encounter timeliness to be one of our domains that we score on, because we thought the best way to start out with making sure that we get encounters into LA Care is focusing on trying to get them as quickly as possible so then any errors can be addressed and we can have improvement made within a timely manner so that we can capture that clinical quality and events. Oh, this is really sensitive. Okay. Wow, this is really sensitive. Okay, so our agenda for today, back up to, there we go. Sorry guys, we have a little bit of a sensitive dial here. So our agenda for today is that we'll be talking about our electronic encounter submission process, and you might have also heard this called the 837 pathway. This is when we get electronic data directly from your electronic health records to LA Care through our clearinghouse. Now, Greg White was going to be joining us today, but he won't be, so I'll be speaking to his slides. And then we have Jackie Huertas from TransUnion, who will be showing us a little bit more about how you can track your encounters through our clearinghouse, TransUnion. Next up, we'll be talking about HEDIS specifics, and we'll be talking about direct and supplemental data, and then also audit requirements, particularly when we're talking about non-standard supplemental data. So Grace Kim Crofton will be bringing that to you. We'll have a couple of slides on other data sources through HEDIS, PM160, and going through CARE, the California Immunization Registry. And then we'll tie it all up with some encounter data reports with Matt Paritano, who will be showing you what we have available so you can track your encounter data. So we'll move on and start talking about the electronic encounter submission process. And this is mainly focused on our capitated IPAs. So basically the IPAs that receive capitation or capitated reimbursement from us. That means they're not sending us claims, and so we have to have a way to represent the encounters that happened when they performed their clinical services. And so we call those encounters. And so LA Care receives those encounters from our IPAs by going through a clearinghouse called TransUnion. And so we'll be hearing a little bit more from them. Now, we want to really emphasize that you all, as IPAs, obviously are working with your providers to make sure that those encounters are coming from the electronic medical record through either your IPA or through your MSO, and then they come to LA Care through TransUnion. So you all will have a different pathway, IPA to IPA, or whether you work with an MSO. Find out more about that. Make sure you know about it. If you are the IPA, make sure you're communicating it. And we will always recommend to the providers to go through their normal pathway to submit encounter data. LA Care will never be trying to give them a different pathway for this electronic process, and we will always use the terms go through your normal pathway or normal reporting channels. So basically, the point is that we would like this 837 formatted data, which is 5010 X12 compliant, to come from the EMR through whatever those normal channels are and be submitted directly to TransUnion. So TransUnion can perform initial data validity checks. And then once TransUnion has accepted the encounter data, LA Care will receive it. And that's what we'll be talking more about today. Also, keep in mind that TransUnion does provide encounter error reports. So you all as IPAs or MSOs can track if those encounters haven't been accepted, and if so, why, and so you can correct those errors. Common errors include duplicates and possibly erroneous coding, so make sure you take a look at what kinds of errors are there so they can be corrected, and perhaps so you can improve your process for the future. What we will be looking at today with the TransUnion presentation is they have a web-based application called ClearIQ, and that is a way that you can correct the encounter data right through that application. And keep in mind that the more correct your data is, the better it is for not only LA Care to understand what you're doing, but also for the Value Initiative for IPA Performance and Pay for Performance payments. You could get a higher payment based on better clinical quality and a higher volume and a better timeliness of your encounters coming to LA Care. So make sure you address those errors quickly so that timeliness especially is not negatively impacted. And now we will move on to talk to Jackie Huertas, and she will tell us a little bit more about the TransUnion ClearIQ portal.
Hey guys, good afternoon. I'm going to go ahead and log into our ClearIQ portal, so bear with me one quick second. We were having technical difficulties, so I do apologize.
Okay, and we do have the slides up if you'd like to speak to what we're looking at right now as well.
Almost there. Sorry, guys.
Should we go back to the slide?
Yes, can you please go back to the slide?
Sure, we'll do that.
My apologies, we're definitely having challenges this afternoon.
Okay, no worries. Okay.
Okay, guys. So thank you again. I apologize. Good afternoon, everybody. My name is Jacqueline Huertas. I'm one of the account managers here at TransUnion. I'm going to go ahead and review a few things with you. First off, we're going to go over ClearIQ and some of the unique features that we have to offer, like our mass edit functionality. And then in addition, we're going to go ahead and go over our featured reports that are shared with our PPGs. First thing, since we are having a few technical challenges getting into this WebEx meeting, I'm going to go ahead and just go through the actual screen that you are viewing now. This is our ClearIQ screen. In particular, the submitters have the ability to come into this particular screen here and do any type of corrections manually in the portal. When they hover over, as you see the light blue hue here, they do have several options that they can take based on an individual transaction. They can go ahead and edit a transaction, they can archive a transaction if no further action is needed, or they can view the history. They also have the ability to view as they are hovering over to see if any of the individual transactions are included in a work group. That way they can work their errors through a particular work group. Now, in order to actually correct transactions, PPGs can simply click on the edit feature that they'll see in the ClearIQ portal. Once they click on the edit screen, they are immediately prompted to a claims editor. As you see here, we do have a screenshot of our claims editor where the PPG can make the necessary updates. The claims editor is great in that we provide simplified messaging. As you see here, it has the rejection message. We definitely try to be very simplified so that it is understood what is needed to satisfy the error. Also, next to the rejection message, you will see, and unfortunately this screenshot does not show that, but there is a little option that says how to correct. The submitter can click on that box and is provided additional information as it relates to that particular transaction. They're given information relative to what is needed to satisfy the error and the loops and segments based on the ANSI individual file. Also, this is very great in that if there are additional questions, the field that is actually in a rejected state is highlighted in a light pink. We try to make that as easy as possible so that the submitters not only know the specific area that they needed to go in to make the correction, but also the actual field itself where the correction needs to take place. We basically try to take the guesswork out of where you need to go to correct your error so that it's easily done. Now, once the PPGs correct the transactions, they simply go in to resubmit. What then happens is that transaction goes back through our revalidation, and assuming that the value they supplied satisfied the actual rejection, once they hit that resubmit, it now goes back through our queue and is queued for our next export run, which for LA Care is a daily run. So this is basically where the PPGs go into the system to actually do their correction. Now, in order to do any type of manual corrections, they can do that as well, not manual, but through the resubmission process, a submitter can go and review one of our reports that we have. So this is our weekly error detail report. Submitters, oh, I'm sorry. Can you give me the ball, Carolina? I do apologize.
And do you want the next slide or you want the ball now?
The ball.
Okay. Okay.
Almost there. My apologies again. I'm working from a left-handed computer, so having technical challenges being right-handed, especially at a station I'm not familiar with. So again, my apology. Okay, sorry about that again. So this is an actual report that we share with our PPGs. We do know that some of our submitters prefer to correct via a resubmission. So we have a report that is available with them and helps them with this. This is the way that a PPG can go through and identify all of those claims that are rejected and kind of go through and see what is needed to correct a transaction. This particular report is placed out on the SFTP every week. It is a rolling 2-year report. It's a cumulative error detail report that a submitter can use so that they can take this particular report and either do some high-level analysis in order to identify those transactions that are rejecting, or they can possibly ingest this particular report into their system so that they can correct those transactions in their practice management system and then resubmit those transactions to us. Now, our auto archive feature, once that is enabled for each of the accounts, should they use that same unique patient control number when they use a resubmission as a means of correction, once they resubmit that file, the system goes out and looks to see if there are any rejections that are out there with that particular claim number and archives those errors since the transaction has been resubmitted correctly. The second report that we do have available is our analysis report. This is a monthly report that is emailed to the PPGs, and this can help PPGs to, it basically provides high-level transparency into the PPG's throughput. You're able to see the volume of data that a PPG has submitted versus what has been accepted or rejected by the plan. Not only that, but you can also see total numbers of rejections that PPGs need to review and correct. As you see, there are various slicers here included in the report. They can review history or they can view current data. They have the ability to review by a particular month, a transaction type, which is their institutional or professional transactions. And they can also view if they are a larger MSO, they can review by an individual IPA that they are submitting data for. Since this is a pivot report, they can also pull in other fields. If they wanted to right-click and show field list, they can bring in any of these additional fields that are not currently checked, such as the original file name, so that they can do their analysis and reconciliation based on an individual file name. So to sum up quickly, ClearIQ has a number of features like our mass edit feature, which allows specific fields to be corrected in mass. The auto archive feature would help a submitter to archive transactions in where a resubmission is used as a means of correction. And lastly, our work group functionality, and where PPGs can group together errors based on a set of defined rules, such as MPI errors. All of these tools that we have in the portal or the reporting that we do provide allows PPGs to correct and manage their data more efficiently. The featured reports, those are reports that simply provide transparencies. They basically provide visibility into the status of every transaction so that a submitter knows the history of that transaction and where it is at any given time. So lastly, really quick, if any of the PPGs that are listening into this call have any questions relative to what I've discussed on today's presentation, they can reach out to myself or their account manager, and we'll be more than happy to go over any of these items with them. So that is it. You can grab the ball back. Thank you, and again, I apologize for the delay. Thank you.
Okay, and just wanted to mention that in the PowerPoint, we also have a couple more slides just reiterating what you said, Jacqueline. So there are some points made on the ClearIQ portal, and then a couple of specifics on the analysis report and the error detail report. So if we have a little more time later, we'll see if there are any questions for you, okay? Great. All right, so moving on, we have Grace Crofton here to tell us a little bit more about the HEDIS specifics for encounter data.
Good afternoon, everybody. Okay, how do I page next? Okay. I'm Grace. I'm Grace Crofton, and my team is responsible for HEDIS data submissions and the compliance audit. And our goal is to ensure that we reflect all the services rendered as accurately as possible when we submit those HEDIS reports. And as diligent as you are with the encounter data submissions, TransUnion, working, processing the data, validating the data, and then Greg's team validating the data yet again, we know that there are data leakages. We know that the gaps in data exist, and it will continue to exist for some time. So we are providing our PPGs and plan partners an option to take their routine standard submissions to TransUnion, the encounter data submissions, and turn around and convert into a HEDIS layout and format, which most of you are familiar with that format. It's the Inovalon format, and submit directly to the HEDIS production team. So it's uploaded directly to the LA Care's secure FTP site. So it bypasses TransUnion, and encounters are submitted directly to the HEDIS ops team, shortens the lag time, and limits the opportunity of data leakage. It's still considered encounter data. It's the same data source and content as the 837 files. The only difference is in format and layout. So it's not considered supplemental data as NCQA defines it. So please don't call these supplemental data files, or else we're going to audit you. So no additional audit data validation required. Data is used to identify both qualifying members, so for the denominator, and also for numerator compliance. So someone here put together a nice little flow chart. Thank you very much. 837, so you have this 837 format, usually the same team of people submitting to TransUnion. We'll take that 837 format, encounters, convert it to the HEDIS format, then upload to LA Care's FTP site. What kind of data? So it's all the data that you would submit for encounters to TransUnion: medical claims, encounters, lab claims and values, pharmacy, behavioral health, vision, all the data files that we need for the various and multiple HEDIS measures. And for your initial submission, we do ask that you look back at least 2 to 3 years. I know it sounds very painful, but you just don't know where the data gaps are. And in the meantime, you may have a data lag that spans a year or two. So for the initial submission, we ask 2 to 3 years. And please do send us a provider data file so we can identify the full demographic information along with provider specialty, because many measures are dependent on the provider type. We do encourage, after the initial submission, an incremental data update that will shorten some work and deduplicating time for the HEDIS production team. If you have any questions about this, please reach out to us at HEDISops@lacare.org. The timeline, the time frame for direct data submission. So we are planning to distribute the 2018 file format with instructions by end of this month. And you can submit your data, the encounter data in HEDIS format, directly to us, upload to FTP, anytime between now, anytime in the measurement year, on a monthly basis if you'd like, all the way through May 5th of next year, 2018. Please do indicate A in the file type to denote as administrative transactional data. You don't want to mark it as an S because you are going to be subject to audit. And if it is administrative data, then no additional audit requirements. But be prepared to have your documentations ready on how you extracted the data, processed, and uploaded. Now I'm going to turn to supplemental data, and there's been a lot of confusion, so we want you to be very clear on what supplemental data means. It doesn't mean additional data. As defined by NCQA, it means data that is used for numerator compliance. It cannot be used to identify denominator events. It can be, however, used to identify optional or required exclusion. A good example of this would be like a hysterectomy for cervical cancer screen, and then we can exclude that member from the denominator. There are two types of supplemental data, standard supplemental and non-standard supplemental. What is the difference between the two? Standard supplemental data is like an immunization registry file or standardized systems and processes with file layouts that are standard, data fields are standard, industry standard codes, and includes all data elements required by measure specs. Usually the format is stable year over year. It doesn't change, from one year to the next. And we receive the data files on a pretty regular basis, like a monthly data file from Care Registry, or PM160 data, or lab data on a weekly basis. Non-standard supplemental data is any data that we haven't yet received through encounters, through direct data submission, through standard supplemental data submission. It's usually, a good example of this is when you have an Excel file, like a gap in care report from a plan, and you go through all the member details and you look up in your EMR system and you look up and you start entering the date of service. Oh, look, this doctor rendered this service on this date. You populate that Excel spreadsheet and then you format it in the layout and format that we instruct, that we request, and then you upload that file. That is a non-standard supplemental data. And there are some gray areas, so I'm going to go over some examples. And if you're ever in doubt, just email us at hedasops@lacare.org, and we can review the files with you so you can appropriately categorize. So some examples of a standard is the Care Immunization Registry, lab results, lab files from Quest, LabCorp, Primex, electronically converted CH2B PM160 data. We don't have EHR exports, but we would love to have these from established EHR vendors like Allscripts, Epic, NextGen. We can load it. These are standard supplemental data files. Non-standard is a little bit more ad hoc. So you have like a Medicare in-home visit program, in-home visit services, that's converted to an electronic data. Medical record abstraction results converted to an electronic file. A provider abstraction form, case management database, disease management registry, and as I said earlier, gap in care report with manual lookup and entry of missing services. So timeline, so unlike the direct data submission or encounter data submission through TransUnion, there are some restrictions for non-standard supplemental data. So for standard supplemental data, the audit requirement is that you must declare, if it's supplemental numerator hit data, notify us early. We would prefer that you notify us no later than December of the measurement year so we can get our ducks in a row, because you have to submit what is called a HEDIS Roadmap Section 5. And I'll provide some examples of the questions in the later slides. But that has to be submitted to the auditors in January of the reporting year. The non-standard supplemental data, you must complete the data collection and it must be submitted to the plan by March 1st. That's a hard due date. If you submit it on March 2nd, we cannot accept it. And if you submit it without having submitted the Roadmap Section 5, then we cannot load it. So just remember that whether it's standard or non-standard supplemental data, it must be accompanied by a Roadmap Section 5, which is due to the auditors in January. So you have to start your preparatory work and get an inventory of all your supplemental data sources. And just note that whether it's standard or non-standard, you must submit a Roadmap Section 5. And then the auditors, if it's non-standard, must complete must finalize their approval by end of March so we can move forward with the data load. So just to recap, how do I go back, Caroline?
Right click. Oh, come on.
Let me see if I can. Previous.
There you go.
Okay, there we are. So we talked about the Encounter Data Team at Plan Partners or PPGs. They take all their medical claims, pharmacy, behavioral health, vision, or whatever data sources you have, and they submit an 837 format to TransUnion. Then TransUnion, they do their work, they submit to LA Care, and then we load it into the EDW, the data warehouse. We retrieve that data, and it's loaded into the HEDIS engine repository, HEDIS software engine. The same team may turn around and they format these Encounter data to the non-837 or the HEDIS format and layout. We retrieve those, we load into the HEDIS engine repository. All of this is all well and good, not subject to audits and additional validations. However, for standard supplemental data, we have the immunization registry, the PM160, lab results, EHR records. If you intend to submit EHR exports or any other supplemental numerator hit data source, please let us know as early as possible so you can start preparing and completing the Roadmap Section 5. You must declare it and have the Roadmap Section 5 completed and submitted to the auditors in January. Same for the non-standard supplemental data. We have a gentleman here who is currently, looking at the Excel spreadsheet, and he's looking up in the EMR database to see, are there additional services? And then he's manually entering it. And that is usually a good example of a non-standard supplemental data. We retrieve it. You provide the audit Roadmap Section 5, and we load it after you get final approval from the auditors that, yep, this is good, it passed our audits, you can load. So what does the audit process entail? It's called a primary source verification of non-standard, and it's just for non-standard supplemental data. Depending on the size of the file, the auditor will randomly select about 16 events, or 5%, or 50 at most, so 50 at most. And from each of the non-standard data files. So if you have like chart retrieval for breast cancer for mammograms, and then you have another file for prenatal services, those will be considered two separate files, and you're going to be subject to PSV for both. And since we have two auditors, that's 2 times 2, that's 4 primary source verifications. So if 2 critical errors are found, such as missing proof of service, so the auditors will say, hey, I selected 16 cases, please send me a screenshot of your claims data or a screenshot of your EMR, or send us charts validating this data. And if there is missing proof of service, you cannot produce it, or if the data is insufficient or incorrect, then the auditor will give you a pass and say, hey, okay, all right, I'll select another random sample. So we get another chance. If the errors persist, so 2 critical errors, the auditor will fail the supplemental data source, and we will be unable to use the data to calculate HEDIS rates. So it's really important that you ensure that you have proof of service, because it's a lot of time and effort on your part and on ours, because what we usually like to do is go through a mock PSV prior to the auditor PSV. And LA Care must meticulously track and account for the impact of all supplemental data sources, so it's very important that you indicate an S in the file type, not an A, it's an S, it's supplemental, so we can declare this file, and we go through all the required steps to use the data for HEDIS reporting. This is just an excerpt from Roadmap Section 5, so you have an idea of what that looks like. It's just a set of questions asking about the data source, what measures are impacted, They will ask you for desktop procedures, policies and procedures to ensure the validity and the accuracy of the data. They will ask you about your data validation and quality assurance steps. So you may have a lot of questions, so please, once again, email us at hetusops.lacare.org for any questions, and let's get started early in the season so we can get your supplemental data files and pass all audits. And now I'm going to turn this over to Dr. Miller for additional data sources.
Okay, so just a couple of slides on some particular questions that we've been asked quite a few times. And the first slide is referring to PM160s for children's services. And Grace just mentioned this in the standard supplemental section of what she was describing for HEDIS data files. So at this point, you may be familiar with the PM160 form. It comes from DHCS, from our state, and historically it has been a claim form for children's services, but also has a lot of information about the services that were provided and the information that was gathered based on that encounter with the child and the parents. And at this point, the PM160 is no longer used as a claim form, and you probably are all aware of that. And so it is only used for the information provided on the form at this point. And so LA Care, in terms of what we do to process the PM160, is that we will accept the PM160 form for the information on it, but if you want to receive payment for those services, it must be accompanied by the regular claim form, either a CMS 1500, a UB04, or of course through your electronic pathway like through Office Ally or something like that. So we do take and accept the PM160 forms, and we will continue to do so until the time that we tell you we won't. Now, you have probably been hearing a lot of chatter from the state on this topic, and as of July 2017, they did sunset completely the PM160 for reimbursement for any use, and that included at that time fee-for-service. So it is no longer used anywhere for reimbursement. Now, there is an indication from the state they will likely sunset the form completely, even for its information usage, as of January 2018. And very likely, LA Care will sunset the use of that form at that time as well. But we are waiting to give you the final word on that, to receive the final word from the state on if they will no longer use the PM160 for information as of that time. So what can you do now? Keep providing us the PM160 forms. Keep sending them to us. We will keep receiving them. And what we do with them is we scan the PM160 forms, we convert them into data, and then we load them into the HEDIS data engine to use them for the childhood clinical quality rates. So keep sending them to us. We will continue to use them, and just look out for any notifications for when that will no longer happen. The next topic is the California Immunization Registry, and we are big fans of CARE and CARE2, and you have the link right there. We want all of our providers to be logged in and part of CARE2. So if you were on CARE1, make sure you go in and re-register and get any new training that you might need for CARE2. CARE2 is an update on the first version of the California Immunization Registry, which is really trying to tie together the entire state. So instead of having different counties that are reporting separately, CARE is trying to report for the whole state in one database. So with CARE2, they have gotten to a majority of the state, and they only have 3 more regions that they need to bring in. But otherwise, we have some very good exchange going on for this data. Now, we want you to be able to log into this portal or have it connected to your electronic medical record so that all of your immunizations, whether they are childhood or adult, can be entered or submitted to CARE2, and then LA Care can receive that information. So LA Care receives a download of files from CARE2 every month. So if you enter your immunizations into CARE, we will receive it. And we're working on making sure that we receive that consistently and that we have a good match process for the names and birth dates for the members who receive those immunizations. So please make sure that you are a member of CARE 2, that you can submit or your electronic medical record is connected. And with that, I'll move on to Matt Puritano, who will give you more information about the encounter reports that we have available.
All right. Thank you, Dr. Miller. This is Matt Puritano. So what we're looking at here is a snapshot of the quarterly encounter reports that come out from our incentives team in the Quality Improvement Department. What we're looking at here is the report for year 8 of LAP4P, which was our old IPA level incentive, which will merge with the VIP next year. So this is quarter 1 for calendar year 2017. In table 1 over here, what you're seeing are the encounter per member per year rates that you need to achieve in order to obtain these different levels of reimbursement from P4P. So if you hit the top benchmark, you get 100% of your P4P incentive, and then it goes down to 85%, 75%, and 50%. And here are the targets. If you see green in your box, that means that you hit the top level 4 target. The other thing that we're adding, and we have added on this first version of this new quarterly encounter report, is the encounter timeliness rate. So as Dr. Miller mentioned earlier, we now have an encounter timeliness component in the VIP. So this report now includes both volume data and timeliness data. So the volume data is in this first cell right there, and then we have 2 separate benchmarks for timeliness depending on the path that the encounter data comes to us through. If it comes to us through one of our plan partners, so that's CareFirst, Anthem, or Kaiser, then it's represented in this cell, and we have 2 separate benchmarks, one for the plan partner route and one for MCLA, reason being that based on our analyses, we discovered that there is a difference in the turnaround time for encounters depending on what is the contracted route the data is coming through. The reason being that on the MCLA side, it comes through TransUnion. For the plan partners, it comes through a slightly different route. So you can see you've got your benchmarks down here for the plan partner and your threshold. These are the same types of benchmarks and thresholds that are used in the IPA level P4P program. The threshold is the median, the 50th percentile, and the benchmark is the 95th percentile. So in addition to showing you how you're doing for just 1 quarter, we also give you a running 12 months. The quarter only has, the first quarter that you see will have a run out of 3 months. So that means that we've allowed for 3 months of data to come in. The rolling 12 allows for 6 months of run out. So that gives you a more accurate estimation of what your encounter volume and encounter timeliness is for an entire year's worth of time. As the year goes on, we will then update prior quarters once we have 6 months of data to show you how you're doing with the full 6-month run out. And here is how the payout works for the encounter volume gates. I already kind of went over this a little bit. It goes from 100% of your P4P down to 50%. And this is also weighted by SPD status and age, and you get a number that looks something like that, and it's a per member per year rate. The higher your volume rate is, the more you get back. And lastly, here's how you get in touch with us. So Grace has already mentioned the HEDIS Ops email address. There it is. So if you have any questions about supplemental data or HEDIS data or anything that Grace discussed today, you can shoot an email to this address and you'll get a reply. Also, if you have any questions about the VIP, you can shoot us an email at the VIP@lacare.org email. Incentive Ops, if you have any questions about your P4P payments. And if you have any more general quality questions, here's the quality email address.
And just to add that incentive ops, there's a little underscore in between incentive and ops. So it's incentive underscore ops.
Thank you, Dr. Miller. And now we're open for any questions.
We do have a couple questions, and I'll remind everybody that you can use the chat function or the Q&A function to submit your question. Quickly, first question is, what is the HEDIS layout?
I thought there would be that question. The HEDIS layout is our, really our software. We have what is called a HEDIS software engine that generates the rates. So it's a HEDIS data aggregator. So there is a layout that provides data elements and format, and we'll be happy to share that with you if you're not familiar with it.
And those will be
releasing that, end of September. And very similar to what you're already accustomed to if you've been submitting us direct data.
So it's a file format, and basically it's just like if you had an Excel spreadsheet, we would tell you what to put in the rows, what to put in the columns, and describe what the terms mean. That's the kind of guidance you'll be getting at the end of September so that your teams can create this file to send to us.
Right. And again, if you have any questions, you can email us at HEDISOps@lacare.org because you will have lots of questions if this format is new to you.
So next question, do you need to complete a roadmap for registry data?
It depends on what the registry is. Is it your internal registry? If it is not a well-established registry that's widely used, by the state of California. If it's your internal registry, I would say, why don't you get in touch with us. We'll take a look at the data source and how you process the data, how you gather the data, and then we can make a determination as to whether it's standard or non-standard.
We also have a question from someone who is interested in setting up a supplemental submission. What would be the first step to do so?
I would say email us at HEDISOps@lacare.org and let us know that you are interested in submitting supplemental data. Then we can get in contact with you. We can take a look. We can review together your data source and your file format, and we can kind of walk you through the process. And just note that we will immediately send you, if it is supplemental data, the HEDIS Roadmap Section 5 so that you can start to put together your documentation.
Right. And Grace, are folks who are only contracted with our plan partners able to submit supplemental data directly to LA Care?
That's a really good question. I would involve the plan partners so that the plan partners can work with their PPGs and get their ducks in a row, and you will get the support of both LA Care and your plan partner. But reach out to us anyway, and we can, get everyone at the table and we can discuss the process, what would be the best way and how to streamline it.
Right, and we were talking about that a little before. So again, always follow your normal encounter data submission process. So whatever your IPA has told you to do, whatever your MSO has told you to do, follow that. And if you work with a plan partner like CareFirst or Anthem, definitely follow what they are saying. But as Grace said, we can help coordinate if things don't look like they're going the right direction.
It looks like we have a follow-up about the registry question, and it's specific to care.
So this question, do you have a process to confirm?
It's actually asking about roadmaps. Do you need a roadmap if you're submitting care data?
If you're submitting, so if you are extracting data directly from the care registry and you're submitting that to us, before you go down that road, get in touch with us so that we can take a look at how you are retrieving the data, because we also retrieve data directly from the care registry, and we don't want to duplicate efforts. But you may have a better member matching logic than we do. So let's review it together. I think if ever in doubt, reach out to us and let's review the process, and then we can determine the next steps. And do it early enough so we can determine the next steps.
Right. But always make sure to enter into care any immunizations you've done for children or adults really try to make sure they get into CARE, and then LA CARE does receive a file of data from CARE every month.
Okay, so next question we have is, seems to go away. There it is. Do you have a process to confirm PM160 and CARE data that is also being submitted on a claim? It's building on that last
we can determine whether it is submitted as encounters or claims by bumping up the CARE registry data against the claims and encounters data and seeing what, what overlap there might be. For PM160, the same thing, but as Dr. Miller said, as of June, right, June or July of this year, it's no longer, PM160s are no longer used for payment. But we would love to have you continue submitting PM160s because it does make a difference.
Okay. Last chance for questions. Send them in this second.
And we are seeing another question that's talking about CPT codes, the term date on CPT codes that are different from the national. Can you just scroll up on that one just a little bit? Does LA CARE recognize that Medi-Cal can have a different term date on CPT codes than the national term date AMA? TransUnion used the AMA term date to reject some Medi-Cal HEDIS encounters. We feel if it's a Medi-Cal encounter, it should follow the Medi-Cal, probably that should say the Medi-Cal path or something like that, or the Medi-Cal term date. So I'm not sure if any of the TransUnion folks would want to speak to that, but if not, we can take that offline and see if we can get a little more clarity on that topic. But Jackie or Doris, would you want to speak to that? Oh, do we have them muted?
No, they're able to chime in. I think they might have muted themselves.
Okay, so we'll touch base with the TransUnion folks and see if we can get a better answer for that.
Carolina, Dr. Miller, can you hear me?
Yes, now we can.
Okay. So we did speak with the Encounter team last week about it, and I think I have a feeling that the Encounter team at LA CARE, and they did tell us that LA CARE does follow the AMA CPT procedure code. Those encounters, those procedure codes that are termed. And actually, I know who probably sent that question. So I will get back to that person who sent that question and get a call with the Encounter team at LA CARE, that PPG and TransUnion together next week.
Great.
Okay. One more, it says, where can I find more information about provider incentives for encounter submission?
So definitely keep in mind you'll be receiving this PowerPoint after we finish, and also any of the other webinars that we've done in the past have a lot of information about not only the provider incentives, but the value initiative for IPA performance, and then some more information about encounter submission. But this webinar will have the most packed information regarding encounter submission in particular. So take this and use this. You can certainly contact us at any one of these email addresses if you have specific questions. And you will be receiving more information and guidance from us as to the best way and the timeline to submit your encounters, whether it's 837 or through the supplemental file pathway.
When will the next HEDIS gap report, or POR, be refreshed?
Around mid-October.
Yeah, the plan is mid-October right now, so we're a couple weeks away.
Distributed mid-October.
Right.
So mid-October and coming soon. Look for your provider opportunity reports.
And this is a little different than our topic today, but are there any changes to the chlamydia screening measure coming up? Not that we know.
Not that we've heard.
Yeah. Okay, well, that's it for questions.
Okay, well, thank you very much for joining us today. We're very happy that you could stick it out with us and learn a little bit more about our Encounter data submission process. Especially, we want to thank the TransUnion folks for being with us today. So thank you very much for being with us, Jackie and Doris and all of the TransUnion folks. And again, thank you to our presenters, Grace Crofton, Matt Piritano, Carolina Coleman for managing the webinar itself, Greg White, who couldn't be here today, and for me, I thank you very much for working with us, and we will continue to make our process as best it can for you, and so you can provide that best member care for all of our members. We really, really appreciate your work. Thanks so much.